This video will demonstrate the proper technique for performing a mid-lower face treatment using the small 90-watt applicator. The mid-lower face consists of the area between the malar region or cheekbone extending to the mandible or jawline. It also includes the submentum, also known as the chin strap. Before performing a mid-lower face treatment, it is important to mark the treatment areas using vectors. This will allow you to organize your treatment so that you are spending more time in the areas of greater laxity. While your patient is sitting, mark the first vector, which we call the Nike swoosh. Using your thumb, locate the malar fat pad or cheekbone. Place the heel of your hand over this area and gently pull the skin up. Take your skin pen and make a dotted line from the side of the nose to the tragus. Your line should look similar to an elongated Nike swoosh. Next, locate the mandible, and using your skin pen, make a dotted line right on the bone from the chin to the tip of the earlobe. For the submentum, mark 2 finger breadths below the jawline. The experienced clinician familiar with treating vectors may choose to treat the vectors without marking the face. Position your patient comfortably and apply a generous amount of gel from the cheekbone to the jawline. Start the treatment using the appropriate treatment settings. You will decrease the energy based on patient feedback as well as the clinical endpoint of erythema. Your patient should feel intense heat but not pain. Instruct your patient to say stop before the sensation of pain is felt. When the patient says stop, reposition the gel. Oftentimes, during this short pause in the treatment, the skin cools enough so that the patient can continue at the current power settings. If the patient says stop again, decrease the power in increments of 5 to 10. Treat from cheek to jaw for 6 minutes using slow sweeping motions. It will be necessary to reposition the gel throughout the treatment. Be sure to do this quickly to minimize cooling of the skin. Remember to use gentle downward pressure and be sure to maintain the applicator tip perpendicular to the treatment area to ensure proper contact of tip to tissue. After you've completed the 6 minutes, you may leave the gel in place and add or move gel to the chin strap. You will start treating at the lateral aspect of the neck, moving the applicator towards and past midline. Treat this area for 4 minutes. After you completed the 4 minutes, go back to the face and treat the 2 vectors for a total of 6 minutes. Prior to treating the first vector, using a tongue blade, move the gel from the cheek area to the first vector. You may apply additional gel if necessary. While using your gloved hand, pull the skin up and treat using slow sweeping motions. You will want to treat in 2 rows as this will allow the skin to relax before the next pass. Once you've completed the first vector, you will now move the warmed gel down to the second vector. Using the heel of your gloved hand, pull the skin up and off the jawbone. Be sure to treat using 2 rows to avoid excessive heating of tissue over bone. After 6 minutes, return to the chin strap and treat for an additional 4 minutes using the same technique as previously described. Always consult the treatment settings guide for appropriate treatment parameters.